and a warm good afternoon to everyone. Situation report for today, Wednesday, November 17. We continue to respond to the COVID-19 pandemic. We have done a good job so far in terms of containing the third wave of infections. And so over this past week, we've only added 26 new cases. So the case count for this past week is 26, 18 cases less than the previous week. We've only admitted one individual to the hospital over this period. We've discharged two COVID-19 positive patients, and we've had 62 recoveries during this period. Today we will we are notifying you of an additional COVID-19 related death. This recent death occurred, and it's an individual who was unvaccinated. So this is the summary slide. It provides you a snapshot of the COVID-19 with 2,304 cases reported on St. Kitts and the remainder on Nevis. We continue to enjoy a significantly high recovery rate with 2,670 cases recovering fully, and that leaves us with 58 active cases. So we are monitoring 5 active cases on the island of Nevis and 53 active cases on the island of St. Kitts. And these numbers are the lowest they've been in months, and we are happy, and we hope that the number of active cases continue in this direction, meaning continue to decrease. At present, we only have one individual admitted on the COVID ward at the JNF General Hospital. And as I said before, we now have a total, or we are now reporting a total of 28 COVID-19 related deaths. When you analyze the demographic data of the individuals who would have died, we realize that 86% of the 28 cases, the individuals were unvaccinated, and 68% were 60 years and over. So what does this equate to? This data is really telling us that if you are an older adult, and meaning 60 years and over, if you are unvaccinated, if you're still unvaccinated, and I dare say add if you are, if you have one of the chronic non-communicable diseases, or if you have a number of comorbidities, your risk of becoming COVID positive is increased, and so is your risk of developing or progressing to moderate to severe disease of COVID and even severe COVID. And so those of you who are older with multiple comorbidities, we are asking you to note this information, empower yourself with the knowledge about the COVID-19 vaccines, and come on board. When we look at the data regarding the positive cases, the 2,756 positive cases, we realize that 70% of the cases were not vaccinated. And so again, if you are in the Federation and unvaccinated, your risk of being diagnosed with COVID is significant. Now, the Ministry of Health conducted a comprehensive audit of our COVID-19 vaccination data. And so we want to thank Dr. Rosales, our national epidemiologist, and Ms. Akila Moore, our medical statistician, based in the Health Information Unit at the Ministry of Health. So they conducted this audit, and this afternoon, the dashboard. So as at 8 a.m. this morning, Wednesday the 17th, 24,509 individuals were deemed fully vaccinated. So in other words, that gives us a coverage rate of 79.3% of the adults receiving the first dose, 72.6% of adults fully vaccinated, and 13.3% of the children 12 to 17 year age range, they have received the first dose, and 10.6% the second dose. By the end of work day this afternoon, we note an increase in the coverage rates, and so 79.4% of our adults have now received the first dose, 72.8% of our adults are now fully vaccinated, 13.3% of our children receiving the first dose, and so we see by this afternoon, a 0.2% increase in the number of children 12 to 17 years who are fully vaccinated. And so this provides you the revised vaccination data. And I want to repeat that 52% of the population is now fully vaccinated. Now, I think I showed this slide about 2 weeks ago. This just highlights the SARS-CoV-2 variants of concern. So the Alpha variant was first identified in the UK, the Beta in South Africa, Gamma variant in Brazil, the Delta variant in India. It's important to note because when you look at what's happening in the pandemic worldwide, you realize that the Delta variant is quite prevalent. And so this was first identified in India. Now, in terms of the Caribbean region, there's a little difference. Now, when CARPHA analyzes, they provide us a summary of the data in terms of the samples they receive for genomic sequencing from the Caribbean member states. And so in the Caribbean region, the Gamma variant is the more prevalent. 41% of the samples positive for Gamma, 34% positive for Delta. And so if there is interregional travel, and so the risk of spread of Gamma variant, Delta variant is quite real. And so is the Alpha, because 16% of the samples were positive for the Alpha variant. So that speaks to the risk. I'll give you an idea as to the risk in the Caribbean region. Now, the Delta variant is the predominant variant in the United Kingdom, the United States, Europe, Canada. These are our source markets. So the cruise ship passengers and the inbound air travelers, they're really coming from these destinations, the US, United Kingdom, Canada in particular. Please note the Delta variant is predominant in these territories. Now, in the United States of America, as we approach winter, the case counts are starting to rise, especially in the West, on the West, Midwest. Now, the case counts, they note, however, remains quite low in the Northeast, on the North Coast, on the eastern coast of the United States, where the vaccination rates tend to be high. And then this just shows you what's happening in terms of the vaccination rates in the U.S. So again, states where the vaccination rates are high, that's a protective measure in terms of the uptick, in terms of the number of cases of COVID-19. So we need to continue to push our vaccination program, because that's the best protection we have in terms of COVID in general and the Delta variant. The CDC, data tells us that people or persons who are unvaccinated are of a much higher risk than those who are fully vaccinated to test positive with COVID and to die from COVID. And so this is what the data is showing. Again, our source markets, the vaccination rates are quite high. And so their travel advisories are quite stringent. Canada enjoying, good vaccination coverage rates. So there is a big cry for our borders to be completely open. What does this really mean? This really means that there are individuals who want the air traveler and the sea traveler to disembark and integrate into our society. And so the policymakers and the decision makers would have to ultimately make a decision as to the way forward and how open will our borders be. The Delta variant is coming. Are we ready? This is a rhetorical question. Are we ready for the Delta variant? And so, ladies and gentlemen, that fourth wave seems inevitable. It's just a matter of time. And so we need to prepare ourselves. And there are measures that we can take to prepare ourselves for this eventuality. So how can we prepare ourselves for the Delta variant? Well, first and foremost, we need to strengthen our COVID-19 vaccination program. So, ladies and gentlemen, we need to increase the momentum in terms of our COVID-19 vaccination drive. We need to collaborate with the Ministry of Education and organize mass vaccination sessions for our teenagers between 12 and 17 years. We need to actively target the vulnerable in our population. So I want to use this forum to speak to our private practitioners. You have a number of clients who are 50 years and over with multiple chronic non-communicable diseases. We want you to be intentional in reaching out to them, to those who are not yet vaccinated. Have that one-on-one discussion to empower them, to bring them on board in terms of vaccination. Because this is the best protective measure that we have currently. We need to follow up the COVID-19 first dose recipients, those who have been tardy in coming back for their second dose. And we need to actively target persons who are working in high-risk sectors. So those taxi operators who are driving the COVID-19 certified taxis, the hotel workers. Now, the management of the hotels, they are the ones crying for us to open our borders. But we want the hotel workers, those employed in the industry, to come on board and accept the vaccine, because that space is considered a high-risk space. And the other individuals in the tourism and the hospitality industry, so those individuals working at the attraction sites, and our healthcare workers who have to interface with those who are symptomatic and diagnosed with COVID. So we need to actively target these individuals and bring them on board, because as I said before, the COVID-19 vaccine is the best protective measure that we have to date with respect to the Delta variant or any of the COVID-19 variants of concern. We need to practice the COVID-19 prevention and social measures. And we've been singing this song for the past 2 years. It's an all-of-society approach. It has done us well. It has brought us hitherto. But right now, we need everyone to come on board in terms of recognizing the importance of these measures. These measures can protect you, your family, can protect me, my family, our communities, and the Federation as a whole. So in terms of wearing the face mask, it's critical. So if our decision makers, if the cabinet members decide that we are going to fully open, meaning, inbound air traveler can enter and integrate freely. If perchance the cruise passenger can integrate, can pass if we take down the fence at Port Zante, we really need to keep our face mask on, because you'll be interacting with cruise passengers, you'll be interacting with layover passengers. And so if you're going to the grocery store, if you're going to the pharmacy, if you're going to the bank, if you're going to pay a utility bill, electricity bill, water bill, the teller machine, please keep on your face mask. It's very important. If we are going to fully open, back one slide. Yes, hand sanitization, hand hygiene is very, very important. Now, this makes a difference between those who contract the disease and those who fare well. And so if you are going to interact with anyone, hand a package or a letter, a document, or receive, you need to sanitize your hands after. If you're going to touch a high-touch surface, you need to sanitize your hands, now more than ever. And physical distancing, depending on where you're going, maintain that safe distance to protect yourself and your loved ones. Now, we are approaching Christmas, and so there are a number of events being planned. And so there is a document that is being developed to guide the operations in terms of the entertainment industry. Now, there's a recommendation for the resumption of entertainment, and this would be for fully vaccinated events at 75% capacity. And so we want the event organizers to note this. Ladies and gentlemen, November the 14th was celebrated as World Diabetes Day. The theme for this year, access to diabetes care, if not now, when? Now, in the Federation of St. Kitts and Nevis, we have 11 health centers, St. Kitts, 6 health centers, Nevis. And if perchance you've been diagnosed with diabetes, you can walk into any health center and access care. You can go into any private practitioner's office and access care for your diabetes. And so we want to reach out at this time to all diabetics. Make sure that you're compliant with your medication, if it's insulin or one of the anti-diabetic medication. Because in the context of COVID, it's very important for you to maintain normal blood sugar levels. So if you're diabetic and perchance contract COVID-19, you fare better if your blood sugar values are within the normal range. And so if you're diabetic, you need to be compliant with your medication, compliant with your diet to ensure normal blood sugar values so that if perchance you contract COVID, you will recover without much problems. I want to help my colleague, Dr. O'Loughlin. He would be proud of me in sharing with you the St. Kitts Diabetes Association information regarding the Diabetes Association's 7th annual walk. It will take place this coming Saturday morning. And so if you are going to join us, you are expected to be at the War Memorial by 5:30 a.m. The walk commences at 6 a.m. Looking forward to seeing you there. Ladies and gentlemen, let us be very serious about the COVID-19 protective measures. Accept the vaccine if you are not already on board. Wear your face mask at all times. Maintain adequate hand hygiene and an adequate distance from others when in the public domain. And if you are perchance ill, experiencing any of the COVID-like symptoms, we want you to remain at home. These are the protective measures. These are the measures that are going to protect us from the Delta variant and that inevitable fourth wave. We will fare better if all are on board in terms of adhering to these protective measures. Good afternoon, and I thank you.
Thank you, Dr. Laws, for that informative presentation.